This is not the end of the road for this legislation. The House and the Senate have to come up with some compromise legislation. Is there any way that you see to make this bill better in conference? What can be added?
Well, it's interesting because I'm fairly new at this process. I've only been in the Senate for 2 years. I offered 19 amendments that Harry Reid said no amendments. 373 bill pages that he brought forth on Saturday. I had a number of amendments. I tried to offer 4 of them on Sunday on the Senate floor. I think these are all to strengthen the bill. I think that if you say what can you be added to make things better, I think that if you don't buy insurance and you end up having to pay, I think it ought to go into an account with your name on it so that you can accumulate that money to use it to buy insurance instead of just going into the federal treasury. I think that would strengthen this. I think that you should allow, because the president said if you like your doctor, you can keep your doctor, you ought to allow people on Medicare to privately contract with doctors. If because of all these Medicare cuts, they're having a harder time seeing a doctor, what's the harm of allowing someone to actually see a doctor and make that contract in a private way so that they could then go to the doctor of their choice? It's what the president promised, but Harry Reid and the Democrats have rejected that amendment. And then since they promised that health care premiums would go down, I say just to help you keep your promise, let's give the state insurance commissioners the right that if in any given state the insurance premiums go up faster than the consumer price index, that then none of these mandates would apply for that state. Those are things that I think would make this bill better and fairer for the American people. But you talk about a conference, we'll see if there actually is one. I think the president is going to, in his desperation and the White House desperation to get something passed, anything to his desk that he can sign, and it's very obvious that they're much more interested in signing anything than in actually getting it right and getting costs under control and helping the people of America with their health care and getting health care more affordable and available and increasing the quality, that in that desperate effort, I believe they're going to try to force the House to accept the Senate bill in total, even though, as your last guest said, there are huge differences between the House and the Senate bill. I don't think the White House cares at all about that. I think all they're interested in is getting something to the president's desk as soon as they can so they can sign it. And I'm hoping that the American people have a say over the Christmas holidays with their members of Congress.
First phone call for you, Senator, Defiance, Ohio. Daniel on the Republican line. Good morning.
Good morning, sir. As a legal aid, my question is simple. How are you going to pay for this? You can't ask the people if they have health insurance, because if you do, and they state no, you fine them. That's self-incrimination. It's a violation of the Fifth Amendment of the United States Constitution. You can't come along here and demand that they answer the question, because if they do, and they do it, and you fine them, that's a contract under duress, and that's illegal in every state of the United States, including under federal law. And in 1930, the U.S. Supreme Court, in a 9-0 decision, stated in a Schichter versus the United States that Congress does not have the constitutional authority to require a citizen to buy anything. Therefore, if you can't do any of the three, how are you going to bring the people in, the young people, to put into this bill to help lower the cost?
Senator?
Well, I think that's a great question coming in from Defiance, Ohio, and I like the name of that community. And my background is in medicine, not in the law, but it's a discussion that we had this morning, a number of Republican senators on the floor of the Senate in between the votes, of 10 Washington mandate that citizens buy a product. And then do you fine them or tax them? If they don't, can they go into your home and say you must buy this? And I think that's a lot. There's a lot of discussion that we're going to see about that. 20 right now have draft model legislation from the American Legislative Exchange Council, a group that met here in Washington not that long ago. 20 states are introducing legislation to say exactly what the caller from Ohio has asked about. And they want to say, stay out of our state, what to do. And as a result, this could likely get all the way to the Supreme Court in the years ahead with a discussion and a decision about what the rights are of individuals, state rights, individual rights, as well as what the Constitution truly says about this. So his background is in the law. Obviously, he's researched this and knows what he's talking about.
St. Louis, Donna on the independent line. You're next.
Thank you. Two things. First, your party should have done something about lawsuits when they controlled everything for 6 years. Secondly, if Reed can ignore the doctors in the AMA who want people to go to the ER instead of have preventative health insurance because they make more money that way, if they can ignore the media and 44 senators who gets millions from the insurance companies, and the far left who want a public option when they know there's not enough votes for it, and all the Republicans who are just interested in the 2010 elections and who fought Medicare every step of the way, and those who want to delay this as long as they can because they know that might kill the bill. And if he can ignore all their selfish reasons and just pay attention to the working poor of this country, working people who help pay for all of your health insurance, mister, that's who pays for your insurance. They all help to do that. Yet they can't afford to buy it for themselves. If Reed can just focus on this, he'll be the one who's loving his neighbor as himself, the real reason for the season's #1 commandment.
All right, let's get a response. Senator, what do you think?
Well, thank you, Donna. Well, number one, I think you're absolutely right about the abusive lawsuits that you and I both agree raise the cost of care for America, run into lots of preventive, a lot of defensive medicine being practiced. And right, they didn't do that when the Republican Party was in charge. And a lot of the reasons there is, there are a lot more lawyers in this body here on Capitol Hill than there are physicians. And that's why I like people from all different backgrounds and walks of life to serve in Congress. In Wyoming, I'm a physician. Our other senator is an accountant, and we bring real life experiences. And I've taken care of people from all sorts of backgrounds. I know exactly what you're talking about when you talk about the working poor, the people of this country who make our country work and get up every day and go to work to put bread on the table and clothing on their backs of their kids and try to get them up to just go to school and get an education. So I think that's critically important. So you make some very good points, and I'm very distressed, like you are, at the way this bill has been put together. The effects of the special interest groups, all of whom were meeting with the president at the White House. They were the ones that were cutting the deals, whether it was the insurance companies, the drug companies. One group after another went into the White House and cut a special deal, and now they're all asking for special protections. And that's why you see this, as one of the papers this morning said, you don't want to watch the sausage being made, but what's happening up here right now is actually giving sausage a bad name. One of the editorials called it bribery, another called it corruption, for people to sell out their vote only after their state has been given a $100 million prize. And I think one of your next guests coming up is going to be in a situation where they want to talk about that with the Louisiana purchase and the Omaha stakes, all of the money that's gone to specific senators who had concerns about the bill, including Bernie Sanders from Vermont, who was against the bill until they put in a $10 billion program that he supported. So I think that discussions on legislation ought to be based on policy and principle. And if somebody a bill on principle, I can absolutely respect that. But this is all turned into payoffs and politics, and I think it's the worst of what you'd expect to see and what we would want from our elected members of Congress.
Senator, the caller also asked that Republicans stop what she called delay tactics. That is, right now the clock